My name is Joshua Beavers. I'm one of the licensed professional counselors here at RenuYou Tulsa. Marie, my colleague, and I, we are here to talk about why we are so passionate about helping people cope with trauma. I'll let her introduce herself.
My name is Marie McCabe, and I am a licensed marriage and family therapist at RenuYou as well. And Josh and I have worked together for quite a few years now,
That's right.
working with people with trauma.
And when we talk about trauma, I think one thing that's helpful is starting off with sort of a definition. One of the definitions from a clinical perspective of trauma is it can be any experience that overwhelms our ability to cope. And so that can include so many different things that a person experiences throughout their life. And so what we do when we work with people who are coping with trauma is we begin with an assessment to see how it's impacted their life, how it's impacted maybe core beliefs that have developed since childhood, and how it's affecting their relationships and their careers moving forward in life. And so I think that's kind of where we start.
And that is what we look for, is how it has impacted them. If there's no impact, there's probably not a need for trauma therapy. But if it has impacted, then we want to find out what's going on. And we have several ways of doing that. One of those ways is through cognitive behavioral therapy, and both of us are experienced with trauma-focused cognitive behavioral therapy. The other one is through EMDR, which is a eye movement desensitization and reprocessing. We have different ways of treating different people.
And I think something that's important is when people come to counseling, and so sometimes they don't know where to begin in terms of the goals they want to create, the objectives they want to work on. And so I think when we talk about trauma, I think there's even that extra layer of confusion sometimes with how difficult it can be to understand how something has impacted us. and so it can feel challenging opening up and talking about that. But I think throughout the course of sessions, our goal is to help a person feel desensitized to some of the physical sensations that come from the trauma, and help them understand why something happened and what they can do moving forward.
And trauma has many symptoms. Trauma can show up as hypervigilance, being very startled, constantly looking over a person's shoulder. It can also show up as a stomach ache, a headache, reactions of emotional flooding.
I'm thinking of other symptoms
Sure.
that we know from our diagnostic criteria, such as nightmares, flashbacks, attention difficulties, and it can look like so many different things. I believe that you are experiencing some traumatic symptoms, to make sure that you schedule an opportunity to meet with a licensed mental health professional to help assess what exactly could be affecting those symptoms, and so where we can kind of narrow down and maybe rule out certain diagnoses. If you are interested in learning more about if trauma could be impacting your life in a negative way, so feel free, please reach out to one of the professionals here at RenuYou, and we would be more than happy to meet with you and go through that assessment.
That's correct. And we actually will look forward to seeing you.